I originally came here to speak more about my mom, but I just kind of found out about the task force yesterday, and so kind of a little unprepared a little bit, but I do want to share two stories. First, my son. When something that I keep hearing that's reiterated throughout this conversation is a lack of support. So I went through a horrendous high conflict divorce, and I knew there was something wrong with my son. And people kept looking at me like, it's your fault, it's your this. And I kept reaching out for help, and I would get like 2 minutes with a behavioral health integrated, and they're like, oh, well, here, go over this place. And we put him in counseling, and 6 months later, that counselor would quit, or they would change. So it's right when they were starting to get attached, starting to have a bonding, he would do this. And we would keep doing this for a couple years, and my son developed encopresis. And he is now almost 11, and...
Can I ask, just in case anyone in the room doesn't know what that is? What that is?
So encopresis is actually when you develop defecated stool in your bowels, and then you end up having explosive diarrhea because there's so much defecation it squeezes around there. It can be the number one cause is psychological development. And so we went through special GI specialists, and we got a lot of great help getting a person to come down from Children's Hospital, and we got to see them here. And to no avail, all he said to us, it's all psychological. And there's no reason why your son should be doing this. And then we would try to get psychological help, and every 6 months, we would be trying to reestablish, get back in. And then when the problems I have, and it goes back to this data collection, maybe 2 out of the 8 meetings, we literally spent the entire hour collecting data versus therapeutic care for my son. So he didn't get any bit. And I sat there in that room, and all the conversation was directed towards me and nothing towards my son. And during this time, too, I didn't know what I was doing, but I felt like it was all my fault. And I couldn't live in the situation I was in, and yet my child now has an adverse experience. And finally, and he still has encopresis to this day. And we finally found someone who started working with him more holistically and naturopathically. And for the last 6 months, he's not had one accident. And he's at the age that this is truly embarrassing. It's caused him to have major social issues in school. He doesn't even have a good friend. And I live in a great community, but I didn't know how to circumvent that or where that early intervention needed to happen. So, sorry, I'm a little tearful. But mainly I came here to share your story of my mother. So, mental health is not abnormal in my family, and I've got to deal with this most of my life. My mother is a wonderful woman. She's now over the age of 65 with multiple chronic conditions. Recently, she faced severe depression. And because of the way Medicare B is set up, Medicare in general, we couldn't get her help. She couldn't get in to see anybody, and she was told she had to wait 6 weeks, basically, is the waiting list because of her health insurance. And so she spiraled down and down and down, and I didn't know what to do for her. And then finally, she came to the point where she almost tried to commit suicide, and we ended up inpatient. So we were able to get her help through that facility. But my question is, why did we have to wait to that point when someone has to take their life? Why do we have to wait till crisis? Why can't we intervene early? If the one thing that we've looked at through all of our health through the years is preventative care works. Preventative care is cheaper than waiting. It is. We have all the data and all the information, but it's more profitable to wait until it's too late. It's more profitable for a lot of people. Inpatient's more costly, but is it more profitable to our souls, to our community, to the productivity of our society? And I don't really think it is. But one of the reasons why I bring this up is our biggest provider for Medicare in this area is Access Healthcare, and they serve Archuleta, Montezuma, and La Plata counties. There are a few other providers. So I just kind of did a few calculations because I am also a data-rich person and I do like my numbers. Just to kind of get you, that's 96,233 rural populace that it lives in this area currently, according to the U.S. Census in 2018. And looking just roughly at those who are over 65 and those who are disabled, that's 26,836 individuals that qualify for Medicare B. But however, Access Health only serves 2,000 of those individuals. Only 2,000 of those individuals, and they're full. They cannot take on anybody due to the lack of providers. So that's a lack of access to health care. So that's roughly 90% of our population in these 3 counties and about 24,000 individuals that don't have access to mental health care. And on the other part of that, the reason it's an issue is that only 5 out of 50 providers can actually provide that mental health care due to the way Medicare and Medicaid is doing that. I look for solutions, I look for hope versus dwelling on the problem. So when I looked at this and I was like, why cannot my mom get help? Why am I going through all this rigmarole? And it's just, we have 2 major blocks. And so I challenged this task force to look at the legislation, to look at the rules that our providers have to follow. And are these good rules? Is this a good thing? And should we be, taking it to a federal level? And that's kind of what I want to say is that we need to do that. The CMS doesn't break down visits per county. They only break it down per state. So only 0.4% of Medicare coverage went to psychiatric cost. That's very little, and we are a whole being. Mental health is only part of our medical. So we spend so much more money on these medical issues, we don't even see how a person is emotionally or is handling the world, or even how to do something is part of that mental health. We ignore that factor, or we don't spend our money and effort on it. So there are 2 growing problems I keep seeing in this and that I've been looking at is the Social Security Act of Section 1833C actually says limits payments for incurred expenses in connection with treatment of mental, psychoneurotic, and personality disorders. The law goes on for payment purposes to limit 62.5% Medicare approved amount called the outpatient health treatment limitation. However, there's no limitations for diagnostic service, just therapeutic and mental health diagnosis and tests. So I'm going to say this, if I was in surgery and guy's operating, reached my 62.5%, what are you going to do? That's not going to happen. But we're more than willing to risk that with our heads, with what controls the rest of our body, what affects the rest of our body. Nobody really looks at how much mental health really affects diabetes. How much does it really affect our cardiac conditions? When you feel like crap and you feel like bad, are you going to get out and walk for 30 minutes 3 times a day? Are you going to choose to cook or go do these different healthier foods? It's not going to happen. But yet we're only willing as a society to pay for 62.5%. So then another solution I was thinking that needs to be considered is the qualification requirements for mental health providers. Currently, from what I can see, only licensed clinical social workers and clinical psychologists may see this vulnerable population. So that's only 2 types of individuals. Medical health has actually expanded its doors, especially with the Affordable Care Act, to help grant more people with access to health care. And why they did that, they allowed PAs, they allowed NPs, they allowed all these other parts, but mental health still got punished. And yet it's a huge proponent of our health system. So just to give you an idea, these through rural counties that we live in, we only have 7 licensed clinical social workers in the area seeing patients in this insurance bracket. 5 of them are at Access Healthcare. So that leaves out your licensed professional counselors, your licensed mental health counselors, and your licensed family. All 3 of those require master levels. They also require extensive hours of postgraduate experience. And I understand some of the issues that we're going in between federal and state The problem is that we need a task force, we need our government to take it to the federal level. This can't just be solved statewide. This has got to be solved on a federal payment as well. If these people cannot treat our population, I don't know what to do, you know? So the current system, I feel, is biased. It's not, we're allowing for worsening health conditions for vulnerable populations. And unfortunately, it's just gonna grow in the coming years. We are at the edge where the baby boomers are gonna just bloom in the next 5 to 10 years. And currently, right now, 45 million individuals above the age of 65 has 3 or more chronic conditions. And that's huge. How do you think someone mentally copes with being that disabled? And if we cannot help them get through that, if we cannot provide them with groups or provide them with a way to meet people to help them cope with their condition, then what are we doing as a society to help them? So that's one of the things, like, you know, through my mother's mental illnesses and even my son's, like, difficult struggles that I never had that support. And that is not one single time was I ever asked, what support systems do you have in place? And that's something I think, like, we talk about a data checklist, but what supports that person that's getting help? Do they have the support that they need? And what type of groups can they be provided? Because I would just I'm just a person who digs for information. I dig to find out a better solution, and I keep going until something works. And that's kind of what I hope kind of happens. But these are some things that we can look at as a group to figure that out. So it's kind of it in a nutshell. Oh, and then actually I recently interviewed one of our doctors in psychology here. And one of the most striking things she said to me in the interview was, we would like to say we match you with the best persons for your needs, but in reality, we look at your insurance first. And that is really sad. We are no longer people. We are who you are insured by. And it's frustrating. I mean, we're supposed to be individuals, not just a number.